Hello everybody. I will discuss a simple technique for the management of Bleb leaks. Bleb leaks, as we all know, can have disastrous complications like Bleb-related endophthalmitis. The various options for treatment of Bleb leaks are non-invasive, minimally invasive, or Bleb revision. The non-invasive techniques include use of aquasuppressants like beta blockers and carbonic anhydrase inhibitors, use of large diameter bandage contact lenses, cyanoacrylate glue, autologous serum drops, oral doxycycline, and lasering of the bleb with dye application. The laser may be ND-YAG or argon laser, and the dye is methylene blue. Minimal invasive techniques include the Palmberg compression sutures, modified Palmberg technique, autologous blood injection in the bleb, and needling of the bleb. The bleb revision techniques include bleb excision and conjunctival advancement, pedicle flaps, conjunctival autografts, and amniotic membrane grafts. A technique for treatment of the leaking blebs by compression sutures was first described by Dr. Paul Palmberg in 1996, and subsequently there have been various modifications of this technique. In this technique proposed by Dr. Paul Palmberg, the idea was to create a narrow rectangle or an X made of 80 or 90 nylon sutures. The anterior suture is passed through 50% depth of the limbal cornea, and the posterior aspect is fixated to the fornix episclera. By displacing some of the aqueous away from the hole in the conjunctiva, the leak will have less internal fluid pressure, thus allowing the tissue to heal. This technique was further modified by Dr. Marlene Moster, who took radial sutures. We followed a similar technique where we put multiple radial sutures. We took the suture anterior to the bleb, passed it underneath the bleb, taking the scleral tissue, and the tip of the needle came out behind the bleb, and then we applied multiple radial sutures. This was the follow-up. As you can see, from the cystic ischemic bleb, the bleb become lobulated and vascularized. To conclude, we have applied the Moster modification of Palmberg compression sutures for the treatment of leaking blebs and found it to be successful in most of our cases. The technique is easy to adopt and minimally invasive. The sutures can be selectively removed if the IOP becomes high at any time point during follow-up. Thank you.